This is the New Alliance Talk, Health Data Synergy, forging intercontinental alliances for better health and well-being. Please welcome to the stage, Frida Mathilde Forslund from Transform Health.
Good afternoon, everyone. Thank you so much for coming. I hope we will have a few more people join us in the next few minutes. So my name is Mathilde Forslund. I am the Executive Director of Transform Health. We are a global coalition of more than 200 organizations advocating and supporting the enabling environment to ensure the equitable, inclusive, and sustainable digital health transformation to achieve universal health coverage. Central to this is ensuring robust health data governance frameworks are in place. One of the core areas of work, this is one of the core areas of work of Transform Health, and we are advocating for stronger national health data governance legislation and for the development of global and regional frameworks to build alignment and commitment around what is needed. We're also convening discussions and collaborations across stakeholders, including co-chairing the Africa CDC flagship initiative on health data governance, which we co-chair with the Pan-African Health Informatics Association, HELINA, and work very closely with the Africa Union, the Africa CDC, and many other partners. We also develop tools that countries can use to assess and strengthen national frameworks on health data governance. And we then also support the implementation of these national efforts, working with governments and partners. So today's panel, we will focus on the vital role of health data governance initiatives in improving care, saving lives, and driving innovation. With over 30% of global data being health-related, the lack of interoperability as well as weak legislative and regulatory frameworks remains a major barrier, causing inefficiencies, privacy risks, and missed opportunities to responsibly use the data for public benefit and improved health outcomes. Both in Europe and in Africa, they are advancing efforts to build secure, connected health data systems. So we'll hear how Africa-Europe collaboration and public-private partnerships can unlock this potential by improving care, strengthening health security, and enabling research and innovation across both continents. So it's my pleasure to invite our panelists to join me here today. We have Lacina Koné, CEO of Smart Africa, and Sophie Herken, Managing Director of GIZ, Professor Sylvia Thun, Director of Digital Medicine and Interoperability at Charité. She's also the recipient of the Federal Cross of Merit. And last but not least, we have Hermann Gröhe, co-chair of Konrad Adenauer Stiftung. A warm welcome to all of you. Thank you for being here. I'd like to first turn to Ms. Anna-Sophie. Given the growing momentum across regions from the European Union's push for health data space to Smart Africa's efforts to advance digital health through interoperability and emergent technologies in AI, how do you see future health data initiatives contributing to more resilient, inclusive, and data-driven health systems globally?
Thank you very much. So if you look at the global health data space, I think the numbers are pretty impressive. So the market looks to be gigantic. And why is that? First, there's a lot of demand. So the global digital health market size is projected to grow by more than 20% over the next 5 years and reach a market volume of nearly $1 trillion. These are quite impressive numbers. And second, you have supply. So the healthcare sector alone generates about 30% of all available new data on a global level. And that reached, just 5 years ago, 2.3 zettabytes, and that's a term that I learned actually, and it translates into the storage capacity of more than 18 million smartphones, which I thought was quite a number. So the potential for the use of these global health data is enormous, particularly if you consider that 97% remains unused. So nowadays you only use 3% of that vast data space, so it just shows what's possible. And also to access and use this data, it needs to be shared within and between sectors and among countries, because pandemics, they do not stop at borders, and so why should our data systems? So we need strong alignment on a technical level, but also on a political level. And let's look to Europe. This March, the European Union has started with the implementation of the European Health Data Space, EHDS, which is a pretty good example that shows how data can be shared. And just to give you an example, and I don't hope for any of this, but if you would collapse here and be unconscious and go to hospital, and they could just access your data if you have any allergies, heart conditions right away. And apart from this, they could use the anonymous data also for research and development. So why should we keep this for Europe? Why not for Africa? So what if patients across the African continent could experience this too? So with African health data spaces, we will reduce fragmentation, and medical records for HIV, tuberculosis, and other diseases might be on different systems, but they would speak to each other. And this would result in seamless care, data use, and medical innovation. As I said, in Europe, we're just starting, but there's great potential to also foster an African health space. And there's huge potential also for the private sector, because health data spaces can enable digital health markets and innovation ecosystems, both in Europe and on the African continent. So currently, you have most of the technical solutions that are required, but a significant challenge is on the political level. So we need common standards, we need shared language of data to communicate, and we need to sort of implement it and adapt it to local context. And to build this, we as GIZ, we have started to facilitate dialogue on digital public goods and on open standards, ensuring global compatibility with the EU. And while many countries are making progress on the African national level, we also work with the African Union and Smart Africa on a continental digital One Health platform where such data can be integrated, shared, and analyzed. And we're also working and looking forward to strengthen with the partnership with players such as Charité, present here today, and we've been discussing that quite a lot. So perhaps for now, let me ask you, what if we would not just wait for the change, but if we would be the ones designing it and shaping it and actually moving forward? And this is why I look forward to that kind of diverse panel today.
Thank you, Anna-Sophie. And maybe over to you, Lacina Koné. You've heard from Anna-Sophie what she thinks we can do in the Africa region. Let's hear from you what your perspectives are on the same question.
Thank you very much for inviting us to this panel. First of all, I want to say the healthcare systems, one thing you may not know, that Africa gained from 1980 to now, which is 45 years, 1 billion and 50 million population. Whether you're rich or you're poor, whether you're digitally connected or not, whether you are AI savvy or not, you need a health care. But the paradox is the fact that people all know that there's a deficit in healthcare system. There's no country around our planet making money. Healthcare is not a money-making system. However, it is a cost multiplier. If you have a healthcare system, you're preventing diseases when people get older. That's where you get your return on investment. Talking about that, in your question, when we talk about healthcare, first of all, we look at the resiliency, we look at the inclusivity, and we look at data-driven system that Sophia just talked about. What we've been doing in laying foundations at Smart Africa for the African continent is to build a continental blueprint which will drive each nation how to go about the healthcare system in health tech. And you may tell me, oh, why health tech? We need healthcare services without hospital. If you look at Africa, today, the doctor per capita represent 1.8 doctor per 10,000 people. In Germany, it represents 44 doctors per 10,000. That is the challenge. So how do we overcome that? So we have to put systems together, such as the blueprint that we are launching, together with the toolkit, of course, in a partnership with the GIZ. And we have to do it in a way, it has to be resilient, which means sovereignty has to be taken care of from the get-go. Security using a cybersecurity has to be built in, as well as we look at privacy as well by design. Because when you talk about healthcare, and Sophia was saying, if something happened to anyone now, they take you to any hospital in Germany. They don't even know if you're diabetes or not. How do they access this information? It has to be with your permission. And this is exactly what we do. We're not only doing it, we do have tools such as SADA, Smart Africa Digital Academy, for capacity building. Two, we have a data governance that we also put together a guideline to be able to use as a vehicle, as well as the convening power, the African health tech leadership that we are actually launching for ICT ministers, as well as the health ministers to be involved, to be able to increase the awareness.
Thank you so much for sharing those perspectives. So over to you, Professor Dr. Sylvia Thun. What are some of the benefits of these initiatives for Africa, but also for Europe and maybe for Germany as well? If you can elaborate on that. Thank you.
Thank you. It's a real pleasure for me to be part of this really important discussion and to hear your words. And everything what we are doing, I'm a medical doctor and I'm an engineer as well, has purpose for patients. And not only for all patients in Berlin, but patients in Germany, in the EU and worldwide. So there's a huge community which exists since like 50 years. They are working together on a very high level, at WHO level and at ISO level, and they try to find a unique language for medical diagnosis and lab results and so on. So this is what we are implementing at Charité, and we try to have foundations as well from all our hospitals in Germany, where we bring together all the data, but the data stays at the hospitals. We bring together people. It's all about people who want to work together and who trust each other. Scientists who trust each other and who really want to share data, so we can really do better decisions, not only research decisions, but also political decisions based on evidence and evidence-based algorithms and good and high quality data. So beside that, if we have huge data platforms, we have a broader research cohort. So there are many things that we are doing right now. There's already in Germany this platform, which is the research data platform, and this is compliant to the EHDS as well. So we already did it, and it works based on international standards. And we can really do many things like post-market surveillance, pharmacovigilance questions, early warning systems, or incident tracking together with our Minister of Health. We can detect rare and other diseases much better, and if we have more data and more data from other continents, we can detect them and do clinical studies upon this data. So we work with real-world data, not just data which comes 3 months after we did the reimbursement and insurance data, but this is real-world data. We get this data out of our lab, and then we can really do our research on this data. So beside that, we have to think about antimicrobial resistance as well, and climate-sensitive diseases. And right now we are developing diseases, vaccines and new cancer drugs, as you all know, based on the mRNA research. And this is all what we are doing, but this is just a small part of all the things we are doing with our new research platform. And we want to collaborate not only in Europe, but in Africa as well.
Great. Thank you so much. So over to Mr. Koné. So we've heard from Professor Sylvia about the implementation of the health data space in the European and the German context. Can you maybe also reflect a little bit of some of the benefits of these initiatives in the Africa context?
Very interesting questions. The pandemic has no border. If you all remember in 2020 what happened, when the pandemic actually breaks out, there's no frontier, there's no boundary for the pandemic. So for us, we need to participate in this to have a seamless per patients. For example, if we had a system, a healthcare system using a health tech during a pandemic, why the QR code will actually be relevant? It wouldn't be relevant because if you come here exactly, the European will be able to know what happened exactly in Africa or even in Africa among themselves. And we found the world fragmented during the COVID where you have an American system, you have a North American system, you have a European system, you have an African system. You don't know what system is what exactly. So I think it will allow us to gather all our effort together to combat the pandemic because it is our common enemy. And when it's a common enemy, there is no multipolarity, there's only multilateralism because the common enemy do not wait and do not segregate. These are one of the benefits. Together, even within our African content, some areas were hit a lot by COVID, some of them were not hit by COVID. The countries that were not hit by COVID, they're the country who actually embraced the digital technology to fight back. Yeah. So these are just to cite few of the benefits.
What a great example. So taking that a step further, as we see rapid advancements in AI and innovation, how can these technologies be responsibly harnessed to strengthen health data governance initiatives in Europe and also across Africa? And over to you. Professor Sylvia first, and then we will have Hermann go next.
No.
Oh, Hermann? Okay, Hermann, go next. Yes, that's right. Yeah, sorry.
I think it's up to a robust frame whether these revolution we see in many parts of our medical research, but also in the health systems at all, will improve to the better or change things to the worse. A robust, good frame could use AI and the tools by global or at least continental data mining to fill gaps or to increase the divide. It's up to the right frame whether we will improve access, free and fair competition. And I think everybody knows that this cannot be done on a national level. We started with a European space for health data, but I think we need to enlarge that, and there are activities between the AU and the EU to make that a common European Africa, and so in the end, global effort. I think it's up to quality. To give a quite old-fashioned example, the seasonal flu every year, the vaccine needs high-quality data, genome sequencing from the first time we saw the new mutation. Otherwise, we can do whatever we want. We will not have the vaccine we need in October. So, proven quality. The question is how to strengthen trust. We see in Europe, we see especially maybe in Germany, a lot of mistrust when it comes to some of these data mining questions, and trust needs guaranteed transparency. Yeah. So that you know what are the algorithm behind a specific development. And this means also fair access, that you not diminish access by tricky tools that makes you dependent on such a system. So the answer is, and that's her specialty, to talk about interoperability, not only on a national, European, but on a global scale. And I think we need to combine global standards with decentralized implementation, because we want countries and regions to find the proper answer for part of Africa, part of Latin America, Europe, whatsoever. So we need globalized standards, but regional or decentralized implementation. Let me add another point. I think we need to address difficult ethical questions. I think one of the main usages of these data mining in the future will be the predictability of diseases. And that makes our system much more efficient when we talk about early detection of specific cancer, for example, to make the measures much more targeted. At the same time, early predictability of diseases where you have no cure is an ethical challenge. And so I think we need also not only stakeholders and global and regional exchange, but we need also a public debate so that trust is growing, because we are addressing also those ethical questions. Let me finish saying, I would like to see the African boldness combined with the experiences we have in sometimes too much regulatory questions and so on. But you mentioned that you need to fill the gap of no hospitals, no physicians, and so on. So I think you are much bolder and seeing the chances of new technologies, while we feel threatened that things where we are accustomed to see a physician, to see that, and go to a hospital whenever we want, to combine this experience with your boldness could be a great benefit for all of us.
Thank you.
Thank you. And thank you for bringing up those really important concepts of trust, ethics, and the need for global frameworks on health data governance. I think that was so important. And also the public debate. I think that's critical to move this agenda forward, both at the political and at the technical level as well. So over to you, Professor Sylvia. Can you give us an example of how you have implemented the health data space across universities here in Germany and across Charité?
Yes, first of all, we invited our industry, local industry and international industry to work together with us, because researchers by themselves do research. They are not the one who do the implementations and the tools and the apps and so on. So we embraced our community, which is a community which is very vivid. It's called HL7, Health Level 7 community, which is in place in Africa as well, like your open MRS framework is based on this standard community as well. And then we decided to have to first do it and then talk about frameworks. That's new for Germans, because we just did it. We just we had the idea and we had the money from our Minister of Health and Science, and so we got the money and then we just did it. We had 4 consortia, and these consortia they tried to find a solution in which way we should really collaborate and share data. And this is the way that you just mentioned. The data is local and our algorithms are then on the data which is local. But beside that, we collected biosamples as well, because some researchers, they need biosamples to really do like the pathological research again or something. And if they have a good question, they can just ask us, give me please in Cologne the biosample from Heidelberg, because I have a patient who is very similar to your patient. Please give me the biosample, not only the data, not only the algorithm, but also really the sample. So this is what we are doing. But beside that, there was, and you mentioned this before, there was a common understanding that we have one semantic language in Germany, and we speak German, but this is not enough, because we just used 20,000 words in Germany, but medicine needs 350,000 concepts. So we decided to work with an international community, which is WHO-based with ICD-11, ICD-10, but also more or less private. It's not a company, it's an organization, the IHDSTO, that's the community around SNOMED CT and LOINC and so on. And so we decided on the content level that we use this language. And now we are translating all the concept from English to German. That's a lot of work, and I think we have in Europe we have 24 different languages that we have now to provide for the national contact points within the EHDS, so that we translate the language. But I don't think that we need it anymore so much, because we have large language models, and this makes work much easier. But still, and because we have AI, we need a common language with a common understanding of concepts.
Thank you for sharing that example from a multi-sectoral collaboration on implementing the health data space, and some of the complexities which also now can be solved by some of these new technologies. That was a great reflection. I'm going to now turn to someone in the audience that is going to share with us a private sector perspective. We do not have a private sector stakeholder here on stage, so we thought it would be very important to bring that perspective into the debate as well. So let me turn to Claire Bonnell at Siemens Healthineers. What do you need, and what can you contribute to advancing global health data initiatives, like the ones we've heard here, the health data space, and also for the Africa region, a similar framework?
Yes, thank you very much, and thank you for allowing this opportunity to speak on behalf of a leading medtech company, Siemens Healthineers, which I'm glad to represent, but also private sector more generally. I think for the private sector, we see that data gaps translate into higher due diligence costs, greater regulatory exposure, and longer time to market cycles. But we also realize that we sit on a goldmine of health insights, which fragmentation that has been mentioned earlier by the panelists is actually preventing us, I think, from unleashing full potential. So two things here that I want to highlight. First, on what would be needed from our perspective is first, harmonized global standards, also mentioned earlier, for data interoperability, but not just technical protocols, really governance frameworks that enable secure, ethical, cross-border data sharing. Second, I'm thinking about more clarity on the regulatory processes that would balance innovation with privacy protection. And third, it's public-private partnerships that would allow to share both risks and rewards of a large-scale data initiative. We can also contribute as the private sector. Our industry could bring proven scalability, advanced analytics capabilities, and of course, substantial R&D investment. We are already developing solutions that can transform population health insights and accelerate diagnosis and treatment. But the collaborative frameworks that I mentioned earlier would also allow Siemens Healthineers, but also other medtech companies, to develop more advanced AI-driven diagnostics and personalized healthcare solutions. It will basically help us amplify the impact globally. It wasn't maybe mentioned here, but I read somewhere that there's 1.5 billion annual savings potential in Europe alone when we think about the global health data initiative at scale. But if we look at what's possible by combining private sector innovation with public sector governance and academic research as well, we see that we can turn health data from a fragmented liability into a great asset actually for better health outcomes. And I think we can all do this in partnership, that private sector doesn't come in only as a manufacturer, but really as a true partner to build alliances. Thank you.
Thank you. Thank you for sharing that. Harmonized global standards, governance protocol for cross-border data sharing, and the private sector is ready to contribute and to be a serious player in these efforts. That's what I think we heard. I want to say thank you to our panelists. But before I do, I want to give you 1 minute each to reflect on what are the case for action, what concrete steps should be taken next to advance global health data initiatives. I will first hand the mic to Sophie, and then we will go down the line here. 2 minutes each for our 2 first speakers and 1 minute each for our last 2 speakers. Over to you, Sophie.
Yeah, I think if we want to put this African-European data space vision into place, I think we need alliances, and thank you for your contribution. So it's about public sector, private sector, research. It's about the different stakeholders, but also the local level. And I think you said it nicely. We need global solutions, but sort of make them fit also to the local level. I think the technical foundation, standards, data ownership certainly is also a point, but also we need to be very pragmatic, I think, on the political level and match what we are doing both to the political ambition, but also to, there's so many existing initiatives out there. So I think we should not reinvent the wheel, but be very pragmatic and sort of put together what's out there. And then I'm quite optimistic.
Great. Over to you, Ms. Konrad.
Yeah, for me, it's leadership must go from strategy to execution. We've done enough talking, and 2030 is just around the corner. And I believe that the cornerstone of that, this is what we're going to do with the signature of our partnership with the GIZ. Number 2 is the interoperability should be the default. Any health data living in a silo has no meaning with or without AI. So interoperability must be the default. That's the reason Smart Africa work on the Smart Africa Trust Alliance to be able to come up together with the Smart Africa data exchange for each country. The third one, we must invest in our local innovations, because scenarios that exist in Europe here, if you look, when I listened to the professor, he said the AI for them, it's about, we can do a lot of research in a very short amount of time. But for us, AI, it is a must. You know why? It's going to bring inclusivity and inclusion into our society, where we cannot build hospitals and healthcare centers in every single villages, but the AI will allow us to actually tap into those populations who are left behind. But to do that, it requires solution. What solution? We're not waiting, for example, for solutions coming from the global north necessarily, but we can empower our local entrepreneur to come up with solutions. So they need to be empowered. They need to be invested in. That's what I have to say.
Great. Thank you so much. Over to you.
Yeah, we should start to test our standards, which are already in place, and invite our industry as well. Just do it. Just do these connectathons that we need right now and have new cooperations, perhaps with Charité and other big hospitals in Africa, and just show that it works. And why do we need it? So just do the things we should do, and then to have a long-term alliance here between, not only between hospitals, but perhaps this is the first step.
Absolutely.
Yeah.
I would like to see Europe and Africa to be in partnership driver of that global development. And I would say that will work far beyond this specific issue. We see a lot of global health issues, but also in the United Nations system at all, that many questions in the last years were overshadowed by tensions between, let's say, the global south and the global north. And if a development which is an advantage for us in Europe, in Africa, is driven by both of us in partnership,
absolutely,
that could have an effect even beyond that needed. I believe that when I mentioned the boldness, and you mentioned again how to reach out for remote areas.
Absolutely.
What is working in remote areas in Africa for sure will give us answers for, to be frank, easier questions to solve in rural areas in Europe.
Absolutely.
But the first blood products brought by drones were starting in Kigali and not in Europe.
Yes.
Because the need make them bold enough to test it. As Sylvia told, let's do it. So I think this partnership can really change things. And since I've mentioned now sometimes the word partnership, I would like to go also to that. There is also a lot of boldness when it comes to public-private partnerships, at least in the German debate, with a lot of mistrust. And I think there are, if you go to universities, you see that there are rules in place that can make those partnerships combinable with fair data access and so on. So the things are in place, but the trust needs to be grown. And I think partnerships between Africa and Europe, between the private sector and the public health sector, can help us to use this revolution for the benefits of our citizens in Africa and in Europe.
Absolutely.
Excellent. So we've heard focus on implementation, interoperability is the default, invest in local innovation and entrepreneurs, long-term alliances, we need partnership, we need to work in existing alliances that already exist rather than building new ones. We need public-private partnership, which we also heard from our private sector intervention from the floor. We also heard about cross-learning and cross-sharing, right? Learning what already works, what doesn't work, and how we take forward some of the existing initiatives between regions. Does that summarize it? Anything else to add?
Very good.
Okay, great. So thank you so much to Professor Sylvia and to Mr. Hermann for your
Now you are signing.
panelist interventions. Thank you so much. And we will now turn to the last segment of this panel.
You and me now?
Yeah, you two left.
We're signing.
So I'm pleased to announce a significant milestone that directly supports the themes that we've explored here today. The Smart Africa Secretariat and GIZ are entering into a strategic cooperation framework, an agreement that lays the foundation for an Africa health data space. And we will have 2 books here for you both to sign.
Just fine.
Okay.
And this partnership brings together the Smart Africa Secretariat, a Pan-African initiative comprising 40 member states and partners committed to accelerating sustainable socioeconomic development through ICTs, and the Deutsche Gesellschaft für international Zusammenarbeit, GIZ, an organization that works to shape a future worth living around the world, a vision it pursues by providing tailor-made, cost-efficient and effective services for sustainable development. So I invite both of you to sign the agreement, and once you're done, we are going to have some applause. And to take a photo.
Yeah, we need to exchange it first. Thank you.
Oh, yeah. I can see it's happening here. I can confirm. Great. Great. All right.
So we made it.
Yeah, I made it. Congratulations.
Thank you, thank you, thank you. Thank you very much. Yes.
And I would now, yeah, sorry, another photo.
Yeah.
Yeah, there we go. Excellent.
On the right, like that. Yeah,
like
I'll
this.
see you. All right.
Like this.
Let's go.
There we go.
Maybe
Okay.
it's all right. Okay.
Or like this, yeah. There we go.
Okay.
Thank you so much. Thank you.
Thank you.
And before you go off stage, we would like to invite you to just have a few closing remarks in this significant milestones and the signing of this agreement. So over to you, Mr. Lacina Koné first.
Well, this is remarkable. This is actually a transformation. It's not just a signature. Transformation for one reason. First of all, when I always says we can no longer be passively optimistic, then we have to be actively intentional. The professor just said it here during the panel, and we're signing this. This let's be a cornerstone for a long-term partnership between Europe and Africa in terms of putting together African health data space. And I'm really grateful to be here, and thank you very much for this partnership.
Excellent.
I keep it short. I know that we both are people of action, so I very much look forward to this, and this will really be great. So thank you.
Absolutely, yes. Yeah. Thank you.
Thank you so much.
Thank you.
And with that, please join me in applauding this milestone and in celebrating this chapter of African-European cooperation for health data and digital transformation. Thank you all for coming and listening, and I hope you have a nice coffee break. Enjoy.